So this is gonna be kind of informal, more conversational. So hopefully we'll take away something. Because honestly, this is an area that, you know, I'm definitely curious in, and I found, at least anecdotally, that there is, it seems like, higher prevalence in this population. So, well, first of all, Embry, I'm curious what sparked this interest for you, this
Yeah.
topic?
Well, I've had this interest, I would say, for a while. Obviously, I'm of South Asian background, and I think within our company, Nayan is probably only the other. Sorry, Nayan, I'm like calling you out. He's probably the only other person that's also of South Asian descent as well. And so, I have seen in my own family, in family friends, extended family, colleagues, that heart disease was significantly prevalent. Over the years, since, everybody loves to have a family cardiologist in the mix, I would be getting a lot of questions from, family and friends about, hey, my cholesterol is this, and they would be, 30 years old. And I would kind of be like shocked, like, wow, like that's crazy that your cholesterol is this high. Or, hey, I had a family member, that just had a stent placed in their heart and they're 45 years old. Or within my family, diabetes is prevalent in pretty much everybody, and cholesterol as well, where my dad and my brother were started on cholesterol medication at a younger ages. And so, I think, knowing that even just within my own family and friends, I've seen it so prevalently. And then also, heart disease not only is just prevalent within the South Asian community in general, but it presents at younger ages too. And so I've actually known of people within, extended family friend circles here within Southern California and within the United States that have actually, passed from sudden death because of cardiac disease at young ages, and especially in South Asian men. So it's definitely something that needs to have more awareness brought out. I think a lot of people are familiar with South Asians in terms of, I think they think, South Asians are Indians, and, maybe they think, okay, Pakistani, but do we really know like what South Asia is? So I kind of just wanted to go into that a little bit before we, go into some questions. And so, what is South Asia? So we obviously know about the South Asian continent, and South Asian continent, the Asian subcontinent. So within Asia, we have multiple different countries. We have East Asia with like China and Japan. We have Southeast Asia, and then we have South Asia. And so South Asia is comprised of several different countries. So you have Pakistan and India, you have Bangladesh, you have Afghanistan, you have Nepal. I'm going to try to get all of them. You have Bhutan, you have the Maldives, Sri Lanka. I think I got all of them. And so it's several countries within that region. So it's not just India and Pakistan, which is probably the places that people are most familiar with. And why does it matter? So I've already kind of, gone into a little bit as to, yeah, heart disease is, very prevalent everywhere, but, within South Asians, it is prevalent. But why do we care? Because within the US, as of last year, there were more than 5 million South Asians that live within the United States. And in terms of an Asian cohort, so we're all grouped together, all Asians are grouped together when, you're filling out census data or whatever it is, or, you're filling out a job application, what race are you? It's always, Asian, and that's it, right? But even within the Asian cohort, Asian Indians are actually the highest percentage within Asians in general. And it's also one of the fastest growing ethnic groups within the United States. And so, I give a quote of 5 million as of last year, but obviously that has, continued to grow and is rapidly growing. And in terms of world population, so all of the South Asian countries in general comprise about a quarter of the world's population. So that's roughly around 2 billion, and probably now even a little bit more because that statistic is a little bit old. So we have to care because these people are here and they're going to continue to procreate, and we're going to continue to have more people. And then why do we care about the heart disease aspect? Because there's other ethnic backgrounds that are obviously adversely affected by heart disease. We know heart disease is the #1 killer in the United States, let alone in the world. Because if you actually look at heart disease patients, and this is by research and statistics that I've seen, over 50% of those patients are South Asian. that is a disproportionately very elevated number. So we have to know that this is something that is adversely affecting these patients. It's affecting these patients at earlier ages, earlier onset. So we have to understand their risk factors, and we have to bring awareness to the community, because I can tell you, even from my own personal experience, having conversations with my own family and friends, a lot of people just aren't very aware, and they're not getting screened, and it's becoming a huge problem. So luckily there's a lot of stuff that's going on, and we'll probably go into that a little bit later, in terms of increasing awareness, and being aggressive in terms of risk management. But I just wanted to highlight those things.
Yeah, no, that's a lot of food for thought, because like you said, like there's we're all lumped together, Asians, but there are actually some cultural, distinctions that one must make. You mentioned, potentially, lifestyle changes. Do you think culturally there are some impacts? Because obviously South Asians are getting heart disease still in America versus South Asians back home.
Yeah, so this is kind of where I'd like to talk about risk factors, right? Because what are the risk factors that are going into why South Asians are getting heart disease? And so it would really be a combination of genetic as well as lifestyle types of risk factors. And so genetics, if you look at it, diabetes is probably on top of the list. And like I had mentioned, in my own family, diabetes is extremely prevalent. Probably 1 in 2 people in my family and extended family, unfortunately, have diabetes, which then puts me at an elevated risk. And not just diabetes in overweight or obese people, which is typically what we see more so in, Western culture, or, European, or, people from the United States. That's what we're more familiar with. But this is diabetes at an earlier onset. And I'm talking type 2 diabetes at an earlier onset, and diabetes that can actually be diagnosed without overweight or being obese. So definitely something to pay attention to. And obviously diabetes is one of the biggest risk factors of developing heart disease. The other one would be high blood pressure. So high blood pressure is very prevalent within the South Asian community. And oftentimes when it's diagnosed, it's, diagnosed when, patients' blood pressures are, ridiculously not well controlled, because it just hasn't been managed. And then cholesterol as well. So, and, I don't know if we're going to go into genetics or whatever later, but, cholesterol is one of those things that has been genetically linked to South Asians, in terms of certain cholesterol components within the cholesterol panel that tend to be more elevated within South Asians than other ethnic populations. And if you're looking at more lifestyle, so, when I was kind of doing more of my research, because obviously, yeah, I know about certain things, but there's actually a lot of research that has gone into studying these patients. And so one of the things that has been coming up a lot is physical inactivity or sedentary type of lifestyle. So if you really look at the lifestyle of South Asians, and I'm speaking more so within the origin countries, right? Because here, as people assimilate to Western culture, it becomes different. They start to assimilate to what, people are doing here. But physical activity, like going to the gym and, making exercise a part of your routine, is not really something that is done there. If you think about why, one would just be lack of awareness. So typically South Asians don't tend to be very obese. They're more so in the overweight category, or maybe even their BMI is close to normal. So a lot of times it's well, I don't need to exercise. I look okay. So why do I have to go out of my way to exercise? Another thing would be, a lot of South Asian countries are third world countries, if not most of them, right? Or all of them. And so it's really lack of access. Where are you going to go to the gym? Where are you going to go to a recreational facility to be able to get exercise? And then also, if you think about cultural beliefs, so if you have South Asian people that are here in the United States, a lot of women don't feel comfortable going to the gym where there's men there. And that's just, a cultural thing and a religious thing for a lot of people. They don't feel comfortable. So there's a lot of, different reasons as to why people would be sedentary. Another big thing is actually tobacco use. So not as much here within the United States in terms of smoking, but more so back in the origin countries like India and Bangladesh. South Asian men tend to smoke a lot, and it's a part of their daily ritual, as well as smokeless tobacco. So chewing tobacco, which used to be a bigger thing here in the United States, And maybe we associate it with like baseball players or something like that, like having chewing tobacco. There, it's actually a huge part of the culture. And so that's something that, you know, obviously chronically used over a long period of time is not doing anybody any good. And then I would also say lack of access to healthcare or limited access to healthcare. And again, that goes back to the fact that, you know, these are third world countries. And so with the millions and millions of people that live in these areas, think about how much access they actually have to appropriate healthcare. I know myself, I've had the, you know, the privilege of visiting, you know, Pakistan for many years, you know, since I was a kid. And my mom has started a charity organization for underprivileged children and providing grants and things like that. So we were actually able to visit a lot of the families in their homes and schools, and just to see like the little that they had, and that, you know, there was even just a lack of like basic necessities. So to even think that they didn't even have basic things to get by day to day, let alone being able to see a physician, this is something that is just, you know, occurring everywhere. And so, and then if you think about what's happening here in the United States, well, think about if you were an immigrant that's coming here, you don't know the language, you don't know the culture, you know, you don't know the religious beliefs, you know, all of those things. And, you know, you might come from a different socioeconomic background. Maybe you can't get insurance. And so it's very difficult to see physicians. And if you do, and many of us know that, you know, when we see patients that don't necessarily speak our language, how are we supposed to communicate with them? You know, even with the translator, it's uncomfortable. You don't feel like you're able to get your thoughts across. And that might just make you feel like, you know what, I don't want to see the doctor anymore. And in someone who needs to see the doctor, I mean, that's, you know, that's a huge issue. So.
Yeah, and I'm curious because my mom does this all the time. There's a inherent distrust of doctors, and she actually refuses to take her meds. Even, you know, I'm like, you need to take your Lipitor. No. Like, how about, I don't know if it's a cultural thing or is it isolated to families? Is there an inherent distrust for the medical community, whether that's at home or abroad? Like you said, you know, language may be a barrier. Do you feel culturally there might be?
I think so to a certain extent, but I probably would say it more so here in the United States when it comes to immigrants coming here than, you know, maybe back home. Back home, I think it would be more of an access type of issue. And unfortunately, you know, status is a thing there. There's huge gaps between classes over there, you know, and it's really unfortunate because the majority of people are in the very, you know, the lowest of the socioeconomic class. And so if you have money, you have access. And that's just how it is over there. And things are changing. Like I'm seeing that there's, you know, charity hospitals that are being built and things like that in more rural areas. You know, and I can only speak for Pakistan, but I'm pretty sure in India and other areas as well, with all of the work that, you know, people are doing. But still, I mean, it's something that's going to take a long time to change. And I think here it's, you know, there can be distrust, not so much because they don't believe maybe the medicine is good or bad for them, but just that like, well, these people don't understand, you know, me, or they don't understand, you know, what I'm going through, or, you know, I can't relate to them, or my culture is completely different, or my religious beliefs are completely different. Maybe it's something that within their religion, it's just like, well, I don't really need to like see a doctor. God is going to take care of me. And these are things that actually, you know, people believe. So yeah, I definitely agree. Like it depends on where you are, but, you know, in terms of distrust, but I think that's more relevant here than it would be back home.
Yeah, and I think, you know, I was reading that Asia, like in particular around India region, is probably in terms of pollution, is the highest polluted country in the world. And we all know pollution certainly increases our cardiovascular risks.
Absolutely.
Um, Speaking of, you know, those are some of the things that we can modify. What about some of the things that you can't, that you're born with? You were kind of mentioning some of the cholesterol markers.
Yeah. So, you know, when I was first looking into this, again, I thought just like everybody else. And this is my, you know, being born in the United States, Western influence, like, you know, I am South Asian by blood, but I was born and raised here. So I'm, you know, American. So that's what I know. And that's what I've been exposed to. That's a pretty naive answer, but it's true. And so when I was thinking about risk factors, like, okay, well, I see diabetes everywhere. So obviously diabetes is probably genetically linked, but like everything else is like probably lifestyle initiated, right? So you're eating a really unhealthy diet, and talk about unhealthy diets. Like South Asians are known for their crazy unhealthy diets, but the food is so good. But that's why it's good, because it's not good for you. But unhealthy diets, you know, physical inactivity, smoking, right? So all of that, chronic stress. And so all of that leads to high blood pressure, cholesterol, gaining weight, you know, diabetes, and that will be your risk factors for heart disease. But actually within these South Asian populations there, I mean, and they've been studied over the past few years, there's actually several different kinds of genetics that come into play when it comes to elevating somebody's risk. So we already talked about diabetes, more early onset, more with people that don't necessarily have obesity or overweight. And that's probably one of the biggest risk factors that we see, or genetically based risk factors. Cholesterol, and specifically certain cholesterol markers. So when we look at a lipid panel traditionally, when we're like, okay, we're going to order a lipid panel for our patients, traditionally we're looking at a few components. We're looking at LDL, we're looking at total cholesterol, HDL, and triglycerides. So even within that, South Asians are traditionally seen to have lower HDL levels than other ethnic groups. They're also traditionally seen to have maybe more elevated triglyceride levels. Maybe not in everybody, but it is something that's more commonly seen. And then also, if you're going to start to do more advanced lipid markers, so we're talking about Lp(a) and ApoB, those actually tend to be more significantly elevated in South Asians than in other ethnic groups. And I was reading a statistic somewhere where it's like 1 in 2 South Asians have an elevated ApoB level, and 1 in 4 South Asians have an elevated Lp(a) level. And so I know that there is a lot more research in terms of these advanced lipid markers and, you know, how they can, you know, increase your progression of developing heart disease. But knowing that this is something that's significant within this community is obviously something that we need to look into, because I would treat that patient, you know, differently than I would treat, you know, another patient that maybe doesn't have that many risk factors to begin with. You know, something else would be the way that cholesterol is metabolized. So some of the defects in those genes that cause increased levels of cholesterol, the way that fat is stored. So I didn't really get to talk about this, but so the way that fat is stored specifically within South Asians has been shown to be more of what we call central or abdominal type of obesity, where they tend to store fat more in their abdominal area. And we know that that independently has been independently linked to an increased risk of insulin resistance, high blood pressure, inflammatory markers, and so on, which can increase your risk of having heart disease. And then also endothelial dysfunction. So having defects within, you know, your endothelium, where the lining of the actual blood vessels is impaired. And so that impairs the integrity of the actual blood vessel, which can then lead to plaque formation and heart disease. And then also impairment in inflammation, meaning that you have a higher predisposition of having increased inflammatory markers, which can then also increase your risk. So those are just some of the genetics that actually can play a role, which is really interesting.
Well, knowing that, would you, as a cardiologist, just say, you know what? Everybody gets a statin. You know, men over the age of 30, statin, women, menopause, statin, South Asians. Would you, I mean, is that how you would treat them?
Yeah, so, you know, that is a really good question, because I think people are starting to change their approach as to how they're treating these patients. So, you know, an example would be a 30-some-year-old young, you know, South Asian guy that, Nyan's like, put statins on the water. Yes, put statins on the water. It'll benefit. But yeah, you know, let's say I see a young 30-some-year-old guy, he's South Asian, he's physically active, his BMI is close to normal, he's got, you know, blood pressure, but there's significant heart disease and there is significant diabetes that runs in his family. Okay. I check lipid markers. His LDL is, okay, right? It's not 100% normal, but maybe it's like a little bit above 100. What do we do? So typically in somebody like that, I'd be like, okay, well, maybe we can just kind of keep a close eye. He's young. He doesn't fit into that, ASAVD risk calculator of us being able to calculate his like 10-year risk or whatever. I probably wouldn't start him on a statin traditionally. Maybe I would just watch him, make sure that he's, modifying his, lifestyle, things like that, right? But now that I know all of this, I'm sorry, if you guys can mute yourselves, whoever that is. Now that I know this information, I probably would be a little bit more aggressive. First, I would probably check some advanced lipid markers like the ApoB and the LP(a). Some people are also, checking coronary artery calcium scores in these patients, which I don't know if it would be as beneficial.
No,
Extra small.
there are.
Chris, I think you're unmuted.
Whoever,
Sorry.
can you
I
please-
think you're ordering lunch.
yeah, it sounds good.
Yeah, sorry, Ambreen.
And I'm fasting, so thanks, Chris.
Um,
Yeah, so all that being said, yes, I would be much more aggressive in how I would treat somebody like that versus, maybe somebody of a different type of ethnic background. Maybe they're just white and they're Caucasian and they're that age and they don't really have much else going on. I might not be as aggressive about starting a statin.
Yeah, and I'm wondering, the data on calcium scoring, right? The MACE calculator, mostly in 40-year-old, over 40 men. Yeah, so that representation in this particular population likely underrepresented. And so how would you use technologies like that, or maybe even clearly? I mean, would you?
Yeah, so there's actually, it's interesting when I was, again, doing my research, there's actually certain programs within the United States. So I think UT Southwestern is one of those places that have UT Southwestern and Stanford, but UT Southwestern specifically has a South Asian, center, which is dedicated to helping these types of patients. And they're actually offering, they're doing a research study that's offering just CT angiograms to all of these patients and seeing if they can catch disease at an earlier state. And so now that we do have technology like Clearly, and things are definitely changing, and it's obviously still not reflected in our guidelines, I would love to be able to offer younger patients these types of exams, because I feel like they could greatly benefit from it, But if anything, taking a statin is not a difficult thing, side effects and all of those aside, and what, people perceive of them, whatever, but like taking a statin is not a difficult thing. And if that is the least thing that I can do, then I can do that. And I can know that that is definitely, because that is proven to be, helping people. And we know that for a long period of time. So, I definitely would consider, starting that on patients.
So we know the benefit of statin stabilization of plaque and things like that. The issue of aspirin and primary prevention is very controversial, right? So how would you approach that? I'm curious.
I don't know. I think, just using it as is, I probably wouldn't. Obviously, if I knew that there was disease, or even if there was a little bit of calcium, like, picked up on a CT scan, I might consider, but I don't think I would just use it up front.
Yeah. I don't know. I mean, it's still, I still struggle with that, honestly. I think Ascend, Esprit, I think did aspirin some disservice, to be honest. So let me ask you, when are you getting your Clearly scan? Would you ever do it?
Well, clearly let me, since I kind of help
For free?
help their patients while they help fund the exam. If they fund it, I would definitely do it. I mean, this is something that I would absolutely consider, just knowing that in general, there's an elevated risk within my ethnic group. I absolutely would. But I mean, just looking at an overall perspective, if I was to counsel patients, or if I was just to even talking to Talking to family and friends. I mean, really, it's awareness, early detection, making sure that people are getting, their checkups yearly, making sure that they're getting their cholesterol checked yearly, making sure that we're going through people's lifestyle habits, like their diet. I mean, I didn't really get to go into too much of what, South Asian diet consists of, but it's a lot of, saturated fats, salts, refined carbs, sweets with, sugar, high in sugar and all of that kind of stuff. And so making sure that we're, changing that. It's very difficult to tell someone who's used to eating the same kind of food all the time. And this isn't just relevant to South Asians, but all different ethnic backgrounds. Hey, just follow a Mediterranean diet. You should be doing that. It's easy. Like, no, this is food that they grew up with and that they're eating, but they can make modifications to make the food healthier, making sure that they're getting more physical activity in. And, obviously knowing that if you do have risk factors like high blood pressure, like diabetes, that's treated aggressively and, early on. So I love all these.
I mean, I really want to thank you for highlighting this because this truly is an issue. My husband, one of his best friends, right after we got married, we were early 30s. He's an ophthalmologist here locally at MGH, died of a massive heart attack.
Yeah.
So it truly is an issue. It's a global issue. And it's so important to have awareness.
Yeah. No, I'm really happy to be able to talk about this because I think, what South Asians are known for is more of the fun stuff like the food and the, fun Indian movies and the Taj Mahal in India. But there is much more to us than all of that. And unfortunately, it's this elevated risk too, which I think is really important for all of us to be aware of so we can treat our patients better.
Yeah, absolutely. Absolutely. Before we conclude, I know we have a couple more minutes left.
Yeah.
Feel free to chime in, anybody, if you like.
Yeah. What are some of the comments here?
And Andrew says he loves tikka masala, I think.
Chicken tikka. I love chicken tikka masala too. I hope you're not eating it every day though. You wouldn't.
I actually, sorry.
Hi,
Sorry,
Tony.
I didn't mean to.
Oh,
Hi, how are
yeah.
you? This is a very, very, very relevant topic to me. So my dad actually had a heart attack at 48.
Wow.
My grandmother on my mom's side died of like some cardiac issue. My mom always says it's heart failure of some sort, but who knows? In India, it could have been like a viral cardiomyopathy or something. So my parents actually changed how they cook Indian food. It was like the same thing. They're so used to this particular diet, so they started using olive oil instead of canola or vegetable oil or whatever. Started using like coconut milk instead of, or like a lighter coconut milk, which is still not the best, but in some of the like creamy dishes and stuff. So started exercising, and like something in India, they never emphasize exercise. Like nobody, they like go outside and they play cricket. Like that was my dad's exercise when he was growing up.
Mhm.
Would come home and eat giant meals, and they don't have any, like there's no such thing as portion control. It's typically like an Indian parent is like finish your entire plate of food and then have some more. So it's like a hospitality thing and culture. But I think this is so important, and kind of going back to my mom, like something that I've done for her. She's not on a statin, even though her mom, we don't really know exactly what happened to her mom, but she's had CAT scans. She's about to have her she had one about 7 or 8 years ago. And these are just things that I mean, I do for my patients, but also like personally for my family. So she has had her CT angio, totally clear. And then is due for her next one. It's been like 7 or 8 years. But then it's like, what do I do for myself? Right? Like, do I start taking a statin because of my dad? And it's really like a personal and like patient dilemma. I wish there was so much more research on this.
Yeah. And it's, thank you for sharing. And, and I'm sure that there, so one of the, and I didn't get to really talk about this, but one of the, actually the only longitudinal study that's actually going on in the United States right now that started back in 2010 is the Masala study, appropriately named the Masala study. But it actually involves many different centers, but started with UCSF and Northwestern and enrolled a little over 1,000 patients. And over, the past almost 15 years, they've published over 100 papers. They're now on their 3rd enrollment. And so we've gotten a lot of these, a lot of this information from, those studies research that they're doing. And so, and then also, you know, we had talked about Cheri briefly about Kevin, who works at the University of Utah, and so his involvement in Congress and passing the bill. And I think the last
Yep.
time it was updated was back maybe in 2022, maybe last year, the South Asian Heart Health Awareness Act, and
Yeah.
that really increases funding for awareness and research
Yeah, exactly.
within this field. So yeah, definitely. I mean, you know, obviously more and more research needs to go into it, but I'm really glad that we're able to, you know, speak up and bring up awareness, because it's super important. These are patients that we're going to continue to see, you know, at an increased
Yeah.
level.
Well,
My brother's my brother-in-law's brother is actually one of the patients at in the Stanford study that you mentioned.
Oh,
Like
cool.
he was like one of the first few. He's there. So he's like had multiple CT angios, have all been really good. Like it's been really interesting to watch. So it's a great study going on.
Amazing. Amazing. Yeah. Yeah. Let's see
That's
what.
right.
see what-
Yeah. Can't wait to see the outcome of that. Well,
Yeah.
thank you, everyone, and love hearing all your opinions and perspectives on this. And again, thank you, Ambreen, for bringing this to our attention.
You're
Thank-
welcome. All
Great
right.
afternoon, everyone. Bye.
Bye.